This coming Monday, the Ukrainian community here in Western New York will mark 35 years since that country's independence from the USSR. This as Ukraine continues its struggle for survival after Russia's invasion. More than 1,600 days into that war, a nonprofit called Global Care Force continues to send medical teams into Ukraine, and a husband-wife duo from here just got back from such a trip.
This was an exploded drone as we were driving back from the clinic.
Dr. Stephen Kinnicky and registered nurse Ann Schwanda are back in Western New York after another medical mission to Ukraine.
Going back multiple times, we want to let the people know that they're not forgotten, that their suffering is important to us.
The suffering is hard to comprehend.
It is horrible for them. They're up all night with missile attacks.
At least 16 people were killed, dozens more hurt during a recent massive Russian attack on Ukraine's capital city of Kyiv.
The human toll, you just can't imagine what it would be like living like that.
And it's not just big cities being targeted.
This is a school that was bombed in a village.
A village among several visited by this doctor and nurse couple and their fellow volunteers.
Our team went to 15 clinics. Totally, we saw over 1,000 patients.
Patients in war-ravaged villages who don't have easy access to health care and where the nearest hospital is often an hour's drive or longer.
These people get no primary care. There are no clinics in these places. We're seeing people in grocery stores and out in the in the grass, like in their community centers and on their lawns.
In the areas that we go to, almost all the healthcare providers have gone to the military or out of the area. For them to actually go to a hospital or a medical clinic an hour away, get medicines, it'd probably be what their whole monthly pension would cost.
If you weren't there, these folks would just be going without help.
Exactly. If Global Care Force did not take on this mission, these people would have no care at all. This is the EMT in the one village that we continue to go back to.
They shared with me the story of that EMT, the only medical professional in her town who during the Russian occupation would go secretly at night from house to house providing care.
Seeing people like that and the sacrifices they make to take care of their patients, it makes what we do, it's kind of pale in comparison to what these people are doing for themselves.
They can see the difference they're making in the faces of their patients.
She went home and made bouquets for all of the providers that had worked with her that day.
As the war rages with no end in sight, this couple hopes people here at home don't forget about the fight for freedom.
Russia has taken their children, Russia is taking their lands. If Ukraine falls, then it's Poland, it's Slovakia, it's Hungary. It becomes a world war if we don't help these people.
I think it's important that we don't forget Ukraine and that we continue to support them militarily, economically, medically. I think it's crucial.
This is your way to do that.
Yeah.
Their work is far from over.
We will be going back again. Next spring is our plan to go back again.
They've paid up to $6,000 out of their own pockets for each of these trips overseas, in addition to volunteering their own time. But you can help out by giving Global Care Force a donation online.